Thank you very much, Suanya, for inviting me to this important event. I feel really honored to be part of it. I thought I'm talking about Dr. Chaudhary, and I wanted to link to what she had been laid out before, but now I'm trying to make my point, and Dr. Chaudhary's contribution will fit, you will see, to what I'm saying very well. She explains what weird parenting is. Weird is an acronym for Western, educated, industrialized, rich, and democratic. That has become characteristic of a particular group of the world's population, people living in so-called Western countries in affluent middle-class contexts. And these people make up for about 5% of the world's population, so a pretty small percentage. But their psychology, the psychology of these weird people, is taken as the universal quality characteristic for caregiving all over the world. So this weird parenting is encapsulated in the so-called attachment theory. Attachment theory is a monocultural normative framework that is regarded as universally valid. Research for validating it across different cultural environments is confirmatory in that attachment researchers are only looking for confirmation and disregard and ignore other scientific and other cultural realities. So it's bad science, actually. Nevertheless, it is based in the Western middle-class family model with parents and few children living in a nuclear household. Attachment is considered to be an emotional bond that emerges out of exclusively dyadic parent-infant interactions during the first year of life. The resulting attachment quality can be secure or can have different forms of insecurity depending on the prompt, adequate, and consistent parental responses to infant cues, but only to a particular set of infant cues, that is facial cues. Face-to-face interaction is crucial, as are signs of positive emotionality in the face, smiling, both from infant and parent. Talking permanently to the baby is important, as are toys that signal cognitive stimulation that is regarded as crucial. I cannot go in all the conceptual and theoretical flaws of attachment theory, but I want to stress that it is an outlier in the landscape of parenting globally, as I said before, for a very small percentage. Unfortunately, attachment theory has not only become the most popular theory of socio-emotional development worldwide, it has also made its way into numerous applied fields like early education and the ECCE conceptions, social work, counseling and psychotherapy, and others, and tragically also in family court decisions. It is the basis of the evaluations that mainly psychologists are doing and that serve as a reference for the court to take children out of their families and separate them from their parents. I had made several training seminars with these psychologists in Germany and in Austria, who all were following this ideology without questioning it at all. I noticed that it is not only the lacking information and this bad science, but also lots of stereotypes, devaluation, fear of strangers, even racism that were covered under the guise of children's well-being. We have heard about this before. I could awaken some of them, but the majority remained resistant and was not open for arguments at all. This is a thick layer of emotionality that is distorting the perception and that is deeply involved in all this work with families and these decisions. So far, I had no direct experience with families or single mothers that were affected. Often it is in Germany, single mothers also. That changed several years ago when I was approached by a voluntary helper of refugees who supported a single mom from a refugee from a West African country who had come to Germany with her 2 small children. And both of the children were taken in foster care with exactly these arguments of lacking affection when interacting with the children, of not enough face-to-face contact, of not talking and not enough cognitive stimulation. That means bad parenting in their eyes. The lawyers, family helpers, psychologists, judges, social workers, all who are involved, and it's a lot of people who are involved in those cases, take the attachment theory conception of the emotional bond for granted as universal. However, in many cultures, emotions are not openly displayed, at least not between adults and children, or appear very differently in behavior. Whereas the attachment model stresses face-to-face smiling, softly speaking, and affectionate talk, in many cultures, it is physical care, sweeping the nose, cleaning the fingernails, and things like that, that are signs of love and care. I once read an interview with a second-generation Vietnamese German, a young woman. She explained that it would be absurd when she visits her parents to hug them or tell them that she loves them, and vice versa. Her mother would ask whether she's hungry, and no matter what she answered, she would be served 10 or more wonderful dishes. So food is a major component of parental love and of sharing emotions. In the German court system, the accused is pled non-guilty until the guilt is proven, theoretically. In these cases, it is just the other way around. There are assumptions and accusations coming out of the blue, for instance, that the single mother is drug addicted, seriously depressive, etc. Now, this mother has to prove that this is not true, that this is not the case. And that's often very difficult if you go against a system that is completely acting against you. The treatment of the people by people who are supposed to help them is inhumane, disrespectful, also aggressive, with other words, unethical. I have been involved, meanwhile, in many cases of this kind, and I'm closely collaborating with a couple of great lawyers who understand that the system is rotten and help fighting the families and women. Suranya is one of those remarkable people. I came across the Bhattacharya family case many years back and have talked about it in numerous seminars and workshops. I have also described it in my book, The Myth of Attachment Theory. I feel so sorry for all the children and families, and I'm so impressed how Sagarika has survived and succeeded. And please, Suranya, keep going. Thank you.